Welcome back to WKRG News 5 at noon. The doctor is in today. We are so happy to welcome Dr. Joanne Baird with Bayside Orthopedic to discuss orthopedic issues that some women may experience during pregnancy. Dr. Baird, thanks so much for being with us.
Thank you for having me.
Okay, so what are some of the common orthopedic problems that pregnant women experience?
So back pain, low back pain being the most common, osteitis pubis or pelvic pain. They also get transient osteoporosis of the hip, carpal tunnel, plantar fasciitis, lateral epicondylitis, just to name a few.
Wow, I was going to say a lot of itises there.
Yes.
Okay, so why in the world are pregnant women more prone to these problems?
So there's several reasons. The one being they're carrying a baby in their belly that's growing, so they have added weight. This also shifts their center of gravity. It weakens their back muscles or changes that gravity. Their abdominal muscles get weaker because the belly's stretching, which additionally puts more strain on the lower back. Additionally, we produce hormones, relaxin being a common one, because the whole goal of pregnancy is to prepare us for delivery. And so our pelvis actually widens, our joints get looser, so that contributes to joint pain. Additionally, you have just the added weight of birth weight. A lot of women also retain fluid, so you get increased fluid around tendons, increases the risk of carpal tunnel, and all those itises and inflammation.
Wow. Okay, so the question is, do a lot of these issues go away after pregnancy?
Fortunately, yes. There is an end in sight. The majority of them do go away, but additional to just the problems in pregnancy, now we're new moms. We're lifting a baby. We're taking them in and out of the stroller, in and out of the crib, and that baby grows. And each time they grow, they add more weight, and it's more pounds that you probably weren't used to lifting. And so then we get a lot more of the itises with the carpal tunnel, the de Quervain veins, tenosynovitis, inflammation at the wrist, tennis elbow, even rotator cuff and shoulder bursitis.
Wow, that is okay. So what about working out though? A lot of women try to work out. Some aren't sure if they should. They don't want to do too much. Does this help some of these problems that you're talking about?
So it does. So the main thing, if you're thinking of working out and you're pregnant, first of all, ask your OBGYN. They know best. Every pregnancy is different. There are certain risks during different pregnancies that they may say that's not safe. They'll also be able to guide you on which exercises to do. But we have learned that it is generally safe, and it is better for the mother's health and the baby's health to exercise and do a routine cardiovascular workout throughout pregnancy, even into the third trimester.
Yeah, are there certain exercises that you steer more women to, like, okay, go for a walk or something like that?
So walking, light jogging. If you were working out prior to that, typically you can continue the same exercises. As we get into the second and third trimesters and later into pregnancy, you want to avoid certain exercises like sit-ups and a lot of ab work. Okay,
well, Dr. Joanne Baird's been our guest today for The Doctor Is In. If you would like to ask her some questions, she is going to stick around and join us on Facebook Live at 12:30 on WKRG's page. So go ahead and type away and I'll ask her your questions. Thanks, Dr. Baird.
Thank you.